My name is Dr. Muhammed Majeed. I'm the founder chairman of Sami-Sabinsa Group of Companies, and I'm talking to you from Bangalore, India. It is a fast-growing segment of any industry, and worldwide it's about 7 to 8% growth. India will also grow at that rate. The international market altogether is about 182 billion in 2015. India is about 4 billion, and I expect that it will grow to 10 billion by 2022. The Indian scenario is a mixed one. There is a big market here, and there is a big export market also from India. So people are interested in both segments, the Indian segment as well as the international segment. And there is a continued growth here, but there are problems also there. Part of the problem is a good percentage of the raw materials that are used to make the nutraceuticals are either available scarce or prohibited by the government from exporting. So continued cultivation of medicinal plants is extremely essential to have the sustainability of this business. About 25 years back when I started the export of this item, there was plenty of raw materials, but along with me came another 50 plus companies, and India has always taken from the wild resources, but wild resources are not sustainable. Therefore, in the coming years, we will see difficulties in exporting, or even for that matter, for the Indian use of Ayurveda for many of these products. Essentially, my background is from pharmaceutical, and I was in 1988 started out creating a generic drug group. Then, due to various problems, it did not happen, and then I looked at what are the other opportunities. Interestingly enough, China sells a lot of materials to US, non-standardized, poor quality. And I looked at the Indian opportunities. There are plenty of herbs which are very relevant in Ayurveda and pharmacologically very effective. So I thought of designing a group of products that will go into the US market in a better, standardized, clinically tested fashion. And this idea and approach helped me build a basic business and expand and open up the market for India for the Indian nutraceutical products. So far has been a very interesting one. In 1975, I went to US and I worked there, and at the same time I studied also, finished my PhD. I was with major pharma companies like Pfizer, Caravalas. In 1988, I went into my own business, started the business there. In 1997, I diversified and decided to build a manufacturing facility in Utah, another state in the United States. In 1991, I set up Sami Labs in Bangalore to get into research and manufacture in India. I in fact wanted to make India as my manufacturing and research base, which I did. Even though I had a research base in Princeton, New Jersey, I brought that back to India. Now, once I have my research base established here, I moved my business from Sabinsa into Germany, Japan, Australia, China, South Africa, Korea, and into various companies. And in 2010, as part of my diversification, I started a group called Sami Direct, which is a direct sell model company, and introduced both the nutritional as well as cosmeceutical items through that one. The company is doing extremely well. Then in 1999, I went into a business called Organica Aroma Chemicals, because they were all imported at that time into this country. And some of my scientists suggested that we can create all these products in this country, which we have started. This started in 1999, still going strong in that business. Then I went into clinical research and set up a separate group to handle the clinical research requirement for us. And this year, I'm in the process of completing an animal test facility here in India to do research, basic research on some of our herbal extracts. The USP of my company is basically high quality. Okay. Everything that we do is standardized, preclinical and clinically documented, and that we bring it to the market. And science is never left out as an option. Science is the major concept we bring forward. And we bring forward quality of the products. And that's paramount importance to us. And we take a stand when it comes to adulteration of natural materials, and we fight against that. Now, for example, curcumin. It's what Americans call it a nutraceutical rock star, and was pioneered by me for the US market. But recently, people who could make it synthetically very cheap have started adulterating the material with the natural curcumin. Now, the entire clinical documentation is on natural curcumin, while mixing this one will bring down the price, but at the end, the customer is not getting any benefits, but the fellow who is making the mixture gets the benefit of saving some money. In the early stages of my business development, the believability in Ayurveda was a major one. But over the years, the Americans and the Europeans have gotten over that one. Now they accept Ayurveda can be a source of tremendous quality materials. Now, in some corners of the world, the trend still continues. For example, in India, most of the allopathic doctors are absolutely or blissfully ignorant of the benefits of Ayurveda. And trying to educate them, I find it very difficult, because they want all the documentation. Even if I give the documentation, it is not as effective as the other allopathic products. But what they don't take into account is the other allopathic products has very serious side effects also. And the nutraceutical doesn't have that. But, the most important challenge is to have the right quality people with you all the time. And although in India there are so many well-educated people, finding the right team for you is always a challenge. We will continue in the same line, nutraceutical and cosmeceutical lines, and we will continue to add excellent quality natural products into our portfolio. And we have two objectives. One, in our plans for vertical integration, go back to cultivation and reach out to the market with more science. This is the future plan we laid out for you, and research will be the backbone of our business. Thereby, quality products can be brought to the market. See, Sami-Lab's main focus is to bring out products based out of science, for which research and development is an absolute must. Our R&D center is focused in India, Bangalore, but we have many research collaborators in the US and in India. For example, we are partners with Princeton University, Rutgers University, and many other universities in the United States. In Taiwan, I work with another group in doing some research. Even in India, we work with different Indian Institute of Sciences to develop some products.